Thank you. Good morning, everybody. Again. I hope you enjoyed your year. Then we will start our second session of the day. I would like to introduce the first speaker, Professor Ahmad Siddiqui. He's a PhD in Virginia State University. His research interest in synergic effects of the drugs and natural products in cancer and cardiovascular and metabolic disorders. And he received several outstanding faculty awards in 2020 and an American Association Glencoe Award, outstanding grant, Howard Hughes Medical Institute Fellowship, and he received $3 million in last 5 years grant. So the title of his speech today will be Immune Modulating Activities of Ginger and Covid-19 Infection. And the speaker is the online, and hope you enjoy it. Thank you.
Well, thank you very much, Dr. Ghazal, for your kind introduction. And I really thoroughly enjoyed your talk. That was very interesting. Well, it's almost like 1 a.m. here in Virginia, USA. So it's like, almost 1 hour past since we started beginning of the morning. And it's almost like 11 o'clock in Karachi. So it's like you have only 1 hour left before your morning is going to end. So I guess it's safe to say good morning, everyone, and assalamu alaikum. It's a pleasure to be here online. I apologize that I was not able to come in person because of some schedule conflicts, but I like to thank Dr. Iqbal Chaudhry and Dr. Atar Rahman and the organizers of this conference for the invitation. Hopefully next time I'll be there in person. So it's always a pleasure to participate in those meetings. So today I'm going to talk about immune modulating activities of ginger and COVID-19 infection. So I will basically describe some of the health benefits of ginger and what are the other immune modulating activities of ginger, especially pertinent to COVID-19 infection, and some of the studies we're doing to kind of measure the polyphenolic content and antioxidation activity of baby ginger. So I put this slide just to show you that there are a lot of health benefits that are attributed to ginger. And I put this slide just to also show our young scientists that how different products can be developed and can be marketed. So I mean, ginger is known to enhance immunity, immune reaction, and we're going to talk about more about their immune beneficial effects. Studies have shown that ginger has some cancer preventive effects. It also helps in digestion, and there are other kind of product developed to aid the digestion. It relieves the fatigues, and again, there are certain products they are marketed to kind of reduce the fatigue. And it's actually shown that people who receive chemotherapy, they get get benefits because they feel like a lot of fatigue when they get their chemotherapy, and ginger actually has reduced those some of those symptoms. Ginger has always, has been long known to have protective effects against cold, and there are a number of things like ginger tea is widely used to relieve some of the symptoms. Believe it or not, people use ginger to enhance the sex pleasure. So their products are also available there. Ginger also is well known for its anti-inflammatory effects, and there are products developed just to market to use for as an anti-inflammatory compound. It also helps reduce the cholesterol and also prevents the atherosclerosis. Ginger is also well known to reduce the weight loss, and there's a product which is kind of cream which people can use to actually burn belly fat. Believe it or not, that is available. And ginger is also known to reduce the symptom of migraine. So there are a lot of health benefits of ginger, but we're going to mostly talk about their immune effects. And before I describe, so I will give you some brief description about immunity and the COVID-19 infection. I'm sure you already probably know all about it, but just to refresh your memory. So immunity. So as you probably know, there are two arms of immunity: innate immunity and adaptive immunity. And basically, all these cells or the mediators, cellular mediators of immunity, they come from stem cells. So stem cell differentiate into myeloid or lymphoid lineages. The myeloid lineages results in the formation of myeloid cells, such as like basophil, eosinophil, neutrophil, monocytes, which then further differentiate into macrophages and dendritic cells. So these cells, they all involved in innate immunity, which is kind of non-specific immunity is always there, is the first line of defense. And then with the other lineage, lymphoid cells, they differentiate into T lymphocytes and B lymphocytes, and eventually, B lymphocytes give you the plasma cells, which produce a lot of antibodies. And then we have natural, killer cells. So these all cells are from lymphoid origin, and they constitute the adaptive immunity, which is very specific. So this immunity is in adaptation to certain response. Now, the innate immunity is play a very big role in inflammation, because when these cells they get activated, so these are freely flowing in blood, and when there's an inflammation, there's endothelial cells, which is the inner lining of blood vessels, they get inflamed. So these cells stick to that, they pass through the the endothelial monolayer, goes into tissue and induce massive inflammation. And during this inflammatory processes, a number of inflammatory mediators are generated, which are produced by all these cells like macrophages, neutrophils, lymphocytes, and the endothelial cells. And actually, endothelial cells is regarded as the immune cells, because these are the blood lining as the biggest immune organ, because all the blood lining of our blood vessels, they are endothelial cells. So when they are inflamed, they invoke a massive immune response. So these cells, they activate phospholipase A2, which acts on arachidonic acid. And the arachidonic acid is a precursor to a lot of inflammatory mediators. For example, arachidonic acid is used by lipoxygenases to make leukotrienes. They are used by apoxygenases, cytochrome P450 system, to make hydroxylated fatty acid. They are used by cyclooxygenases like COX-1 and COX-2, and they make a lot of prostaglandin, prostacyclin, and thrombin. So all these mediators, they come from one source, that is arachidonic acid. Now, in case of adaptive immunity, we have B cells and T cells. So what the B cells do, that we have helper T cells, which actually present the antigen, and these antigens actually helper T cells, they get it from a cell which is infected, such as a pathogen like bacteria or virus. So this cell, a phagocytic cell, they process they digest this bacteria or virus, and they display this antigen on their surface, which T cell recognize it, and this T cell, they carry this antigen to B cells, and then B cells, they recognize the antigen and then differentiate into some, becomes like memory B cell, and some differentiate into plasma cells and make antibodies. So these antibodies are against this particular antigen. In case of T cells, so these helper T cells then also stimulate a lot of cytokines, which actually helps maturing the killer T cells, cytotoxic T cells. So when a cell is infected, so this cell, when it get multiplied and released, and then it's infect the other cell. So when a cell this cell then process the antigen, it display the antigen. So these T cells recognize the antigen and kill the basically infected cells. So this is more like an adaptive immunity. So what happens, the innate immunity or this non-specific immunity comes within hours. As soon as you are hit by antigen or bacteria or virus, your system get activated. But adaptive immunity takes time to build the antibodies as well as to raise these cytotoxic T cells. So this is just immunology 101 in a quick description. Now we come to COVID-19 infection. So COVID-19 infection, so SARS-CoV-2 virus has 4 fundamental structure proteins: spike protein, nuclear capsid, envelope, and membrane protein, which is present on the surface. Nuclear capsid protein present inside, complex with the RNA. You probably all heard about this S protein. This is a spike protein. It plays a very critical role in the attachment of the virus to its target cells. What is that? This protein actually has this binding domain, which is called receptor binding domain. So this domain is actually recognized by this ACE2 receptor, which is angiotensin converting enzyme receptor. So this S receptor recognize this binding domain and bind to this to the virus, and then virus can then penetrates inside these cells. So once virus is inside these cells, it releases its genetic material, and this genetic material then makes a lot of copies, virus copies, capsid copies, and then remanufacture, and then a lot of viral cells then get released, which infect the other cells. Now what happens that some of these infected cells, they display the antigen, which is kind of recognized by the macrophages. Macrophages activate T cell, which activate cytotoxic C cell, B cell, and then they induce an immune response. So that's what happens during a normal immune response. That's how our body get rid of virus if everything working all right. But what happens that during COVID infection, when this virus infect this cell, we get a lot of activation of all these cells of innate immunity, like all the neutrophils, monocytes, macrophages, as well as the cells from adaptive immunity, like T cells and B cells, they get activated. And there is a lot of cytokines. And there's the secretion of cytokine is so overwhelming that is regarded as a cytokine storm. So actually, these cytokines act on the other tissue, and they induce a massive inflammation, and that leads to tissue injury. Not only that, the S receptor is not only expressed only on lungs, but is also expressed on intestine, heart, esophagus, kidneys, bladder, testes, liver, and brain. So these virus, when they are released, they are able to infect all other tissues too. So they can infect, when they induce the brain injury, they induce cardiac injury, they induce kidney injury, they induce liver injury. And with this massive cytokine storm, it results in a lot of organ failure. And the person, if it's not treated or or somehow the immune is not become able to get rid of virus, then it can lead to a very serious situation. So, and then one of the serious situation is the induction of thrombosis. So these cells, when they get activated, they release this intrinsic, stimulate the intrinsic coagulation pathway as well as the extrinsic coagulation pathway, and then causes blood coagulation, and that is another consequence of this COVID infection. So what happens after COVID infection, and in most of the cases, like 80% of the people who get infected with COVID, they actually exhibit non-specific, very minor symptoms. And that disease do not progress any further. So this is like a less severe disease. So majority of people, they get really less severe disease. 15% of people, they have some kind of localized inflammation, and which may lead to ammonia or some kind of ammonia without sometime or sometime with hypoxia. Only 5% of infected people, they exhibit systemic hyperinflammation, and they show the symptoms of what we call acute respiratory distress syndrome, or ARDS. And if it is not treated or it is not controlled, then that leads to the critical symptoms. And then this critical, like only 1 to 2 people, they exhibit the critical symptoms, and then they often die. So, so clinically, currently what happens that there's no specific therapy, which is regarded as like an antiviral drug for specific COVID-19 infection. There are other kind of treatments available. There's no specific. So in the absence of this non-specific therapeutic approach, the herbs can provide a valuable source to immunomodulate or to provide anti-inflammatory activity, or sometimes antioxidative activity, or some of the herbs also have the antiviral activity. So we're going to talk about ginger and how ginger stimulate the immune response. So as I said, there are a lot of herbs or natural products that they are known to boost the immunity, and the ginger is one of them. And the effects of gingers, they are attributed to its chemical components, which are divided into 2 classes, like volatiles and non-volatiles. So the volatiles are mostly, they have some biological activity, but since they are volatile, so they are not often available. They're mostly they're contributor of the pungent smell we get from ginger. But these non-volatile compounds, they are responsible for a lot of ginger's biological activity. So these are compounds, they have they have very high antioxidation activity and also anti-inflammatory activity. These are like 6-gingerol, 6-shogol, 6-paradol, and gingerone, and dihydrogingerone. These are the major compounds, but there are other minor compounds too. So what evidence we have? So there are things like, there are extensive data which suggest that ginger actually play a big role to enhance the innate immune response. For example, ginger inhibits phospholipase A2 activity. And as I mentioned before, the phospholipase A2, activation of phospholipase A2 is the very first step to generate all these kind of mediators. So if you block this, it means you can actually inhibit all this inflammatory response. It has been shown specifically to inhibit the COX-1 and COX-2 activity. Again, the COX-1 and COX-2 activity inhibits, inhibition of this would inhibit the prostaglandin synthesis, prostacyclin synthesis. So there's a massive inflammatory mediator, thromboxins, which are involved in blood coagulation. So that can be prevented by use of ginger. Ginger has also been shown to inhibit prostaglandin, direct effect on prostaglandin E2 production, as well as inhibition of thromboxane B2, again, inhibiting the blood coagulation. It also shown to inhibit platelet aggregation, and platelet aggregation, as you probably know, play a role in blood coagulation. Also, ginger inhibits the activation and migration of neutrophils, monocytes, and macrophages. And these are the, the cellular mediators of innate immunity, and their activation leads to the inflammatory processes. Ginger has been shown to inhibit interleukins such as interleukin-1, interleukin-6, interleukin-8, and tumor necrosis factor. And these are some of the mediators which contribute in the cytokine storm. So ginger has the ability to actually reduce or suppress the cytokine storm. So Some of the data what we have is that inhibition of prostaglandin E2 activity. So this is the experiment done by Lentes early on in 2007, where they used like ginger extract as the key component of ginger, like 6-gingerol, 8-gingerol, 10-gingerol, and 6-sugarol. And it's shown that all of these they greatly inhibit the prostaglandin E2 production when the cells are actually challenged by lipopolysaccharides. So lipopolysaccharides are very strong stimulator of monocytes, and that leads to formation of prostaglandin E2. And this can be prevented by using either ginger extract or the purified component from ginger. The other thing what we have is that ginger has also shown to actually inhibit the thrombosis response. What it does, like a component from ginger, 6-gingerol, actually inhibit this is phosphodiesterase 4. What it does is an enzyme which actually break down cyclic MP. So inhibiting phosphodiesterase 4, you increase the level of cyclic MP, which actually activate protein kinase A. And this activation of protein kinase A actually inhibits this neutrophil as extrinsic, these elements which are involved. These are like neutrophil external traps, which play a very big role in inducing the thrombotic process. So by activating protein kinase A, this process can, the 6-gingerol has shown to inhibit this process. Other experiments, they have shown that using compound like gingerone A inhibit monocyte adhesion to endothelial cells. And again, this is the very first, one of the first steps involved in the activation or inflammation. Again, gingerone A inhibited monocyte adhesion on endothelial cells. There's a dose-dependent effect. Here's the quantitative data that inhibiting using when cells were stimulated with tumor necrosis factor A, it causes massive adhesion of monocytes to endothelial cells. But by using the increasing concentration of gingerone A, the adhesion was inhibited. And here is the Western blot showing that the key adhesion molecule, which is like vascular, cellular adhesion molecule 1, which is the protein which involved in the adhesion, is expression was reduced. And here it shows that that the protein quantitative data is the expression at mRNA level. So both the mRNA is gene activation as well as the protein expression, they both are reduced by using one of the compound present in the ginger. Now, so that's about innate immunity. Now, again, there are evidences showing that ginger actually also can modulate the adaptive immune responses too. For example, gingerols, which are compounds present in ginger, promote the interferon gamma secretion from activated T cells. Interferons are known that they inhibit viral infection. So these are regarded as the first protective line of defense against the viral replication. Interferon, there's the name came from interferon because it interferes the viral replication. More recent studies shows that 6-gingerol actually inhibits the polarization of these T helper cells, and activation of these cells causes release of a lot of cytokines such as interleukin 4, interleukin 5, interleukin 6, interleukin 9, 10, and 13. So all these cytokines, they can be in their secretion can be inhibited if the activation of T helper cells can be prevented, and ginger has shown to do this. So it's just a summary to show that all these things which are marked asterisk, these are the responses which are shown in as a innate immune response, like activation or downregulation of arachidonic acid drive mediators, activation of macrophages, inhibition of cytokines, inhibition of adhesion molecule, downregulation of oxidative stress, and then all other molecules involved in inflammation. So they all get down-regulated by ginger. And then these are the response which are the ginger has direct effect on the adaptive immunity, especially on T cell, T17, T helper 2 cells, Th1 cells, T regulatory cell, Th9 cell, Th20 cells. So all these are cells which are involved in the adaptive immunity. So overall, ginger can modulate both adaptive responses and immune responses. In addition to that, ginger is actually shown to protect blood vessels because it has antioxidant activity, it has anti-inflammatory activity, it's also known to reduce the lipid profile, so decreases the cholesterol, which is provide the sticky, which act as a glue to enhance the macrophages attachment to the blood vessels. It also improves the endothelial function and anosynthesis. It's also improved the effect, the activity of vascular smooth muscle cell function. So all of these indirect effects lead to provide protection against blood vessels, so they don't, and also inhibit the processes which involve in blood coagulation. So there's an indirect effect ginger can provide to maintain or to inhibit the effects which COVID does, like acts on endothelial cells, and also stimulate the blood coagulation. Now, there are other direct evidences suggest the ginger has a direct effect on viral infections, such as ginger has shown to inhibit the growth of influenza virus through macrophage activation. Aqueous extract of ginger has also shown the activity against influenza H9N2 virus. And this has also been, very well shown by several investigators. I just one reference here that ginger inhibits the replication of human respiratory syncytial virus, and this is the virus which is involved in common cold. A lot of people get common during winters, so this is the virus, and using a regular use of ginger can prevent the symptoms of cold. Now, fresh ginger is also it's shown as appears to shown talk about that is stimulate the secretion of interferon alpha. We have shown in addition to interferon gamma, which I have shown before, and interferon beta from infected epithelial cells. And these interferon are also involved in the inhibition of viral replication. Compound in ginger like gingerone A has shown to inhibit the activity of or inhibit the replication of influenza A virus. Now, more recent studies have shown that things like gingerol A, 6-gingerol, 8-gingerol, 10-gingerol, they have been shown to bind like SARS-CoV-2. This is papain-like protease activity. Now, this enzyme protease activity is involved with the maturation of virus. So, if this activity is inhibited, then virus replication is inhibited. So ginger has some evidence that it can inhibit the replication of actually SARS-CoV virus. Ginger extract has also shown to bind with S2 receptor as well as spike protein of SARS-CoV virus. Therefore, it inhibits the viral entry. And we have other evidences showing that ginger actually play a role in inhibiting the viral attachment as well as virus entry. For example, here, there's the cold virus, syncytial virus, and there's the data taken from this publication where they use these lung cells. There are two different kind of lung cells are used, and then they this ginger extracts, fresh ginger extracts is used. It's shown that by ginger has a dose-dependent effect on virus loss. So exposing these cells with virus in the presence of ginger actually reduces the virus attachment. Virus load, and as well as virus attachment to the lung cells. So again, showing that it interferes the virus entry into the cell. Now we have some of the other data which is coming out now recently, where people are using ginger extract in different countries, and they reported, like for example, in Saudi Arabia. The studies which published very recently showing that consumption of ginger by COVID-19 patient was increased from 36% to almost like 60% after infection. And reciprocally, the proportion of patients hospitalized to COVID-19 treatment was also lowered among ginger users to 30% then to about close to like 40%, so which were like non-users. So people not using the ginger, there were more people were hospitalized than people using the ginger. A study is, published from Bangladesh showing that people using some, home remedies, home medicine, that's also including like, having some ginger in there, has they actually recovered from COVID without taking, sometime with taking additional treatment or without additional treatment. So it's also, suggests that ginger is actually helping COVID patients. And the study came out from Tunisia showing that, treatment of a few cases of COVID-19 with home medicine containing ginger in combination with other herbal reduced the disease symptoms. And there are a lot of actually work came from Iran, and they're still doing some kind of randomized clinical trials. Iran, a clinical trial study from Iran indicate that a combination therapy by ginger and echinacea in suspected COVID-19 outpatient attenuated some of their clinical symptoms, such as like breath shortness, coughing, and muscular pain in comparison with those treated with a standard protocol using hydroxyquinone alone. So again, indicating that ginger has some kind of effect improving the symptoms to COVID patients. There's also a randomized clinical trial was done in Iran again, showing that patient with ARD, which is kind of is not the COVID patient, but these COVID patient, they also have a lot of ARDs, which is acute respiratory distress syndrome. When they were fed ginger through like eternal diet or in the diet, what happens that they exhibited greater oxygenation. And the concentration of some of the key cytokines like interleukin-1, interleukin-6, and tumor necrosis factor is actually reduced. And they spend shorter time on mechanical ventilation control compared to the control group, again suggesting some of the beneficial effects directly related to ginger consumption. Believe it or not, there not only that, there's evidence says that the ginger use is actually spiked up during pandemic. And there's like there's this article I found that Peruvian, they are not a big exporter of ginger, but because of the ginger demand was so much that they export it to their record level. So they countries like Peruvian, they are even selling ginger or exporting ginger because the demand was so high. And I personally experienced that during pandemic in late 2019 and late 2020. Sometimes you don't find even ginger in the supermarket, it's all gone. So there's some truth to it. People using it, they get benefits out of it. And then that's why the, ginger was born from the market. And it showed that, the ginger market, again, as I discussed earlier, ginger has a lot of health benefits. And this is is linearly increasing. There's a global market which expected to go up to consumption of 4.6 million tons of ginger. They expect to have by 2025, which is not far away, and we have close to 3.7 million ton consumption right now. So ginger has been consumed greatly. And I mean, the thing is, the one thing I found very interesting, that the biggest exporter of ginger is actually India, and the second one is China. And the biggest importer of ginger is Pakistan. And I was surprised to see in 2019, Pakistan was was #1 importer of ginger. And we have things like similar kind of atmosphere, like India has. So I was surprised that, why we don't grow ginger and why we cannot export ginger, because we have all the, things, probably permissive condition to grow ginger. Anyway, that's I'm getting sidetracked here. So we're doing, we started because ginger is, is a healthy product and there's a lot of usage of ginger. So we started doing some research on ginger at Virginia State University. And here's the example to show, that there's a white ginger, which is actually a Chinese ginger. And that's how ginger look like. Is a mature ginger. That's how it looks like. So when we started, well, not me, but my group, the cultivators or the horticulturists, started growing the ginger. What problem we have is that in ginger in Virginia, weather is cold, like in early January or in late or in February, ground it get frozen, so all the ginger get destroyed. So we have to harvest the ginger early on, and when you harvest the ginger early on, it look like this. It's a baby ginger. So all my life I have seen ginger like this, and when I see this ginger, I mean, I thought that this is like look like strange. I never seen ginger like this. So this is regarded as like an immature ginger or baby ginger. So I thought, well, my hypothesis or my expectation was that something is missing chemically there, which is like in the baby ginger, because it's not mature, is harvested early. So what I did, started looking for the total polyphenols. And to my surprise, what I found that the baby ginger has twice the amount of polyphenols compared to mature ginger. So it is like almost like half. So as ginger matures, the amount of polyphenols actually goes down. And similar to this, the antioxidation activity is also high in the baby ginger compared to mature ginger. And this is the assays which are done, like well known, like DBPH or ABTS assay, which are done like in test tube. So and then we also did the experiment using the cellular model. We use endothelial cells, and then because the things that cell also has the antioxidation, natural antioxidation mechanism. So something which is antioxidant has antioxidation activity in the test tube may not have antioxidation activity in the cell. So we did measure the antioxidation activity in the cell. But we found this similar kind of pattern that baby ginger, when it's harvested early, has high antioxidation activity than the mature ginger. We also looked for some of the key components in the ginger. We found that like 6-gingerol, 6-paradol, and 6-sugarol, the three main components, again, they were high in baby ginger compared to mature ginger. And then we also repeated the experiment. So it's like, it's a data from 2 years, and they have the same pattern. So it's not like one year thing that it just happened for some reason, but we found little seasonal variation, and it has the same pattern that we found high ginger, high polyphenol, high amount of polyphenol in baby ginger compared to mature ginger. So just to summarize, I think I'm getting close to my time. Just to summarize, is that what happens that when COVID infect a cell, the macrophages get activated, which activate the T cells, and these T cells, secrete a lot of cytokines. And these T cells, if there's a proper T cell activation, we get viral elimination. That's what a lot of people do. But what happens if there's for some reason, there's a hyperactivation, then we get, local tissue damage, inflammation, cytokine storm. And what happens also that, this activation of macrophages, they stimulate all kind of, other, response. These are the cells of adaptive immunity. They also activate the cells of innate immunity, and we get the same thing. We get a lot of oxidative stress and a lot of inflammatory mediators production. So what happens? The ginger block the activation of these cells, the cells from innate adaptive immunity as well as innate immunity, and then overall it helps reducing the symptoms of COVID infection. And actually it can also, when these cells are regulated, because they are hyperactivated, if their activation is reduced, then probably T cells go to a normal activation, a proper activation, and helps eliminating the viral from the system. So I stop here. So conclusion, just briefly, the ginger acts as multiple sites to reduce inflammation and improves both the innate and adaptive immune responses. And what we found that phenolic content and antioxidation activity is highest in baby ginger. The phenolic content and antioxidation activity decreases as ginger gets mature, almost like it's reduced to almost like at a 50% level. So, the baby ginger can be effective in preventing respiratory viral infection and can provide a more potent effective adjunct therapy against COVID-19. I stop here. I like to thank people. Dr. Razi Rafa, he's a professor, horticulture professor, and he, helped growing different varieties of ginger. My research scientist, Hyman Lee, performed a lot of this work, and I like to thank my director and the dean, who was very supportive of this research. So I stop here. I'll be glad to address any question you have. Thank you so much for your kind attention.
So the feeling was nice. It's also nice to know that ginger has good antiviral properties. As a matter of fact, last month I also was positive, and I used a lot of ginger with the herbal tea, and I recovered. So it's good that you proved that on the mechanistic base. I think we have some time to questions. If you cannot hear, I will convey the message to you, Professor Siddiqui. I think Professor Iqbal wants to have one question.
Sure.
Please.
Thank you very much. Thank you for presenting something new all the time. See, my question is that ginger is, it has a decoction of various variants of gingerol. And gingerol, pure gingerol is also commercially available. So it's because of the volatile constituents of ginger, or it's because of something else?
I think it's all the compounds which are present, gingerol and sugarol. So all this, if I understood the question correctly, you're saying that the effects are because of volatile compounds or non-volatile?
The ginger is known to have a lot of aromatic compounds also.
Right.
This aroma is also very strong and pungent. And many of these activities are because, you know, when someone takes tea, is largely what you get the extract and aroma together. Gingerol is the most important constituent. So have you checked gingerol alone also?
No, we did some experiment and this kind of similar kind of data, but no, because we were kind of interested in testing. We have not directly tested for COVID-19. We're using for some other, like we're looking for his anti-obesity effect, which might present sometime later. So I was just kind of curious because, you know, for same reason, you know, I got infected by COVID. I was really very sick. And the only thing I did is just a ginger tea day and night. And believe it or not, I mean, I was really very, very sick, and then I got recovered, alhamdulillah, you know, with no symptom at all and like fully recovered. So definitely something there, you know, whether it's, you know, there's evidence showing that gingerol and other compounds has, you know, all kind of an anti-inflammatory as well as direct effect on virus, but we have not, you know, actually tested ourselves.
I think we can have one more question. If there's a dying question from the audience, please go ahead. Is there any? Yes, there's one question on the panel. Please go ahead.
Yes, thank you for your informative presentation. And my question that, as you know, the African country, especially in Sudan, we have ritual plant, and some plant we use it for to enhance immunity. Traditionally use it for enhance immunity, and like banana if this possibility, if any plant uses for enhance the immunity, it is possible to be treatment for COVID. Thank you.
I guess, I mean, you know, anything which helps inflammation would be a good candidate. But you know, or anything which can modulate immune function would be a good candidate. You know, like modulate, I mean reduce, because, you know, immune get hyperactivated because of this COVID, or something. You know, if they have a direct effect on viral replication, and because ginger is kind of unique that it also has anti-inflammatory activity, as well as also, you know, there's a lot of literature showing that it also has antiviral activity. So, I mean, you know, the plants in Sudan, you know, depends, you know, if they have something similar structurally, because sometimes, you know, there's a crosstalk, you know, some of the molecules, you know, they are similar. So they might, you know, it's quite possible.
Is there any more questions from the audience? If not, let's thank to Dr. Siddiqui, Professor Siddiqui again one more time.
Well, thank you very much. And again, I apologize. I was not able to be there in person. So hopefully next time I'll be there. Yeah, thank you very much.
Thank you. Pleased to meet you, Professor Siddiqui.
Yeah, thanks.
Okay, our next speaker will be again online. I would like to invite Professor Jörg Rademan from Freie University, Berlin. And his research interests fragment-based ligand discovery, especially for proteases, phosphatases, protein-protein, and carbohydrate-protein interactions, biochemical activity in binding assays, and drug polymer conjugates and polymer regions, ligation reactions and protein template fragment ligations. He has several awards and honors and visiting professor at Auditorium National University in Canberra. The title of his talk will be the protein catalyzed fragment ligations for the chemical evaluation of antivirals and anti-cancer agents. Professor Rademan, the floor is yours. Welcome.
Please unmute.
We cannot hear you, Professor Rademan. You're on mute.
So now you should hear me, right?
I hear you. Welcome again.
Can you see the screen?
Yes. Yes, we can.
Good, that's okay. Then good morning, everybody. Yes, I'm also very sad that I cannot join you in Karachi, but I will try to deliver my speech as good as possible online. And I'm going to talk about fragment-based drug discovery. And we are working on methods that focus on fragment ligation reactions to find improved protein ligands. And so this approach, to start with, I will give you a short introduction of fragment-based drug discovery. Yeah, fragment-based drug discovery is an approach where you start with very small fragments, molecular weight below 250 Dalton. And this has the advantage that you can use small libraries for screening and still cover the chemical space that is available relatively complete. So we have libraries that have, for example, 1,500 molecules and can get hits or can get protein ligands from that. And small fragment that cover. So discovery is to put together several fragments to get high affinity ligands. And this is the process in fragment linking. And the nice aspect of this is that you can, by linking low affinity fragments, you can get high affinity ligands. And that can be explained physicochemically or thermodynamically. Because if you assume that you have a small ligand that has free energies of binding of delta G1 and delta G2 for two fragments, then this can be combined to a binding affinity in the fragment combination that is a product of the KD values. Yeah, so you have a multiplication. Of course, this is in the first step, this is let's say an ideal assumption. In reality, you always have some difference here, assigned here with this X that describes the deviation from the ideal additive case. And that relates then into a factor F that describes the deviation from this ideal multiplication of KD values. Yeah, we will come later to some examples where we have analyzed these values in more detail. Okay, so if you look at this concept, fragment-based drug discovery, when we started to work on that, we identified two major problems. Yeah, the first major problem is a detection problem. You have here low affinity binding of fragments. How can you still measure that with high sensitivity? And the second challenge here is the linkage problem. How can you put together two fragments and get a better fragment combination that has this high affinity that we hope for? And our idea to approach these two challenges is to combine the synthesis and the linking of fragment in the screening in one step. Yeah, so the idea here is, can we get a more sensitive fragment screening and find optimized fragment linkages in a step where we combine synthesis and detection in one step? And this concept is also interesting from another perspective, because it points towards a concept how in chemical evolution bioactive molecules can be formed. And to explain that, I have this slide here. So if you consider the evolution of life from a prebiotic world is a world without living organisms. Of course, the question is, how can that develop from just molecules into life? And so in the prebiotic world, we only have building blocks, and we have all these complex systems in the developed life. And the hypothesis here is that there must be a mechanism that develops building blocks into functional molecules. And we propose that templation is the mechanism that is responsible for this conversion. And so that's the starting point, our concept. And we applied this concept first time already some years ago. And we picked a protein target that was at that time already prominent, and that is the SARS coronavirus protease 1. Yeah, so that's the first coronavirus. This is shown here. This is a protein, just schematically. And what we did first is that we developed an assay. So here we have a substrate number 1 that is cleaved by the protease and releases fluorescence when it's cleaved, and that you can use to measure the activity of the protease. Second, we developed aldehyde inhibitors. Aldehyde inhibitors bind to the protein in the binding pocket and lead to a partial inhibition if it's put in at a concentration where you have just a limited inhibition. And this situation we then used to add 1 nucleophilic fragment per microtiter plate well to identify fragments, 3, that lead to a ligation product, like this imine structure here, resulting in complete inhibition of the protease. Yes, and we did this, applied this concept to a small library of fragments. We screened roughly 300 fragments, just 1 microtiter plate. And indeed, we found fragments that lead to a significant increase of inhibition, like, for example, this fragment. And the combination of these fragments gives complete inhibition. The fragment alone is a low affinity fragment. So we really have the sensitizing effect of the ligation experiment here. The hit fragment from the first round can be converted into an electrophilic structure, introducing this ketoaldehyde that gives us a significant inhibition. And we have used that for a second round of screening. In a second iteration, we screened the same fragment library again found a hit fragment that is low affinity for itself, but the covalent combination gives already then a low micromolar inhibitor of SARS coronavirus protease. And we can follow these steps also in crystallography. So here's a crystal structure of our starting peptide aldehyde that interacts here with the cysteine residue of the active site. Okay, so in principle, we had shown with this work that we can use fragment ligation to identify low affinity fragments and build beta inhibitors from those. Next, we wanted to extend this. So we started here with an enzymatic assay. The next step was to extend it to protein binding assays. And for that, we applied fluorescence polarization. We attached a fluorophore to a binding fragment A. You can measure binding in the fluorescence polarization experiment because the bound fragment has a higher retention of polarization in the emitted fluorescence light. And then you can screen fragments and you can find fragments that have no effect. Yeah, so they just bind next to this starting fragment. You have fragments that can replace the starting fragment. And that's the most interesting part for us. You have fragments that increase the binding of the primary fragment by a ligation reaction. And that can be followed in fluorescence polarization. And we did also here a screen. This time we screened more fragments, 7,000 compounds were tested. We found indeed competitive fragments, competitive binding fragments, and cooperative binding fragments. Starting point was this little ketoaldehyde, 25 nanomolar inhibition. This was the best hit, yeah, 125 micromolar inhibitor, and the combination yielded a picomolar inhibitor of this protein, which was caspase 3, a central regulator of apoptosis in human cells. So with this, we had shown there is the possibility to extend fragment ligation screening to protein binding assays. But we still looked here at a reversible ligation reaction. Yeah, amine plus aldehyde gives imine. And of course, we wanted to extend that as well to irreversible fragment ligations. And for that, we looked at the probably most general reaction in a fragment ligation, that is amidation. So reaction of an activated acid with an amine to form an amide. And the idea was here to look for a protein templated reaction without a background reaction. So a situation where you have this reaction, amide formation, only in presence of the protein template, not without. And to find such reactions, we took another target, factor 10A, a blood coagulation factor. And we had here as starting point active esters of this little dipeptide and reacted it with this amidine, amine, which binds to the S1 pocket of this protein. These two starting points are both millimolar inhibitors. And here we had an example of this super additive fragment combination. Meaning, if you multiply the two Ki values, you expect in the additive case an inhibition constant of 3.7 micromolar. However, what we find here is 29 nanomolar. Yeah, so we have a strongly super additive fragment combination here. It's 129-fold stronger than expected. Of course, here the decisive point was the activation of this fragment. We used a lot of different activation methods to investigate this templated reaction. And in every case, we measured inhibition in a templated reaction, meaning with the protease, with the protein present, and the non-templated reaction. And for these fragments, we always saw no difference. Yeah, there was always strong inhibition. So the inhibitor was formed no matter if there was a protein or not. However, when we reduced the reactivity of the activated peptides here, we found examples with a significant templation effect, significant increased inhibition in presence of the protease. And that was for these phenyl ester and this trifluoroethyl ester. This templation effect with the trifluoroethyl ester worked with elongated time, and it worked also at elevated temperature. Yeah, you could see that the difference here between the background inhibition just by the fragments was getting higher with longer time and increased temperature. We were able to quantify formation of the inhibitor. For example, for the trifluoroethyl ester, there is basically no background reaction at all. And we form here the inhibitor in the nanomolar concentration range. Yeah, so the Cmax values are roughly 10 nanomolar for the trifluoroethyl ester, 25 for the phenyl ester. And this can be explained because this is such a good inhibitor that the protein templated reaction is product inhibited. Yes, if you have enough inhibitor, it blocks the active site of the protein, and then you cannot form additional inhibitor by the protein templation anymore. Here we were able also to get the crystal structure of the product. And you can see in this crystal structure nicely how the product binds. This is the S1 pocket. The amidine binds here an aspartic acid residue. And then there is this hydrogen bond network that fixes the inhibitor in the active site of the protein. From our perspective, especially this hydrogen bond was quite interesting. The tyrosine 99 hydrogen bond with the backbone of the protein. And that was interesting because it showed us how this very specific and selective reaction in the active site of the protein was catalyzed by the protein. Here is from this crystal structure derived docking of the active esters. And you can see here this tyrosine hydrogen bond goes to the leaving group of the ester. Here it's the phenyl ester. And this is the postulated transition state of this reaction. So we have here a close proximity of the nucleophile of this amine with this ester carbonyl group that is the transition state for the amide formation at this point. And this hydrogen bond catalyzes the leaving of the ester substituent here. So that gave us a nice insight, yeah, in this mechanism, how this reaction can be so selective, happening only in the binding pocket of the protein, not in solution. All right, so much about amidation reactions. Next step is that we wanted to go further and use this approach to find irreversible inhibitors, covalent irreversible protein inhibitors. And for that, we looked at another class of proteases, viral proteases, and we took Coxsackie 3C virus protease. This protease recognizes a glutamine in the active site, in the S1 pocket, as indicated here. And then there is a cysteine residue that attacks the cleaved amide bond. Our idea was that we can use this to identify fragments that bind in the same pocket, if these fragments are able to activate a reactive warhead like this aldehyde epoxide. So if this can ligate to a bound fragment, it should place the epoxide close to the nucleophilic cysteine residue. That should enable reaction, attack of this epoxide residue, and irreversible inhibition of the protease. So first of all, we validated the activity of this warhead. Now, this is a strong electrophile, and you can show that it is an inhibitor of the cysteine protease. So it binds and is then covalently attacked, forming this adduct to the protein. We can, excuse me, we can follow the formation of this protein adduct in the protein MS. So that's this weight increase here, addition of the fragment. And we can follow that also in the enzyme activity assay. And it's, of course, it's a low affinity fragment. And we can determine the inactivation rate of this. That's the kinetic constants that deactivates the protein over time. So having this warhead validated, we started a screen. We screened roughly 1,000 nucleophilic fragments. And we found this fragment 2 as our best hit. Best hit means here that the fragment alone is no inhibitor. Only the combination of the warhead with the fragment gives complete inhibition over time. It's again a temperature-dependent inhibition, indicating that we have here covalent irreversible inhibition. And we can identify here the protein adduct again. That is the combined mass of the warhead plus the fragment. We can model how this works. So here's the binding of the fragment in the S1 site, the ligation to the epoxide aldehyde, resulting in the epoxide opening here with the cysteine attack. And there's also an increased inactivation rate compared to the fragment alone. This fragment combination here was then used to synthesize combinations of the binding fragment nucleophile and the warhead electrophile. And we synthesized small libraries of fragment combinations that are stable covalent molecules. And for all of these fragment combinations, we determined the inactivation rates. The initial starting points were the epoxides, as found in the epoxide aldehyde warhead. They were not very good, so slow deactivation of the protein. When we switched to electron-poor double bonds to Michael acceptors, that was much better, especially if we switched to cis or Z olefins and final to vinyl sulfones, where we got the highest deactivation rate here, 1,000. We could also show that this is a really fragment dependent, the inhibition. So it's not just the electrophile that inhibits the protein. For example, here we have this electrophile showing no inhibition at all. Only the addition of this fragment hit gives here a significant inhibition of the protease. All of these inhibitors were clean, irreversible inhibitors. So if you throw it onto the protease, you get in the protein MS the mass of protein plus inhibitor. Then we looked at the spectrum of inhibition by these inhibitors. And for that, we tested a bunch of viral proteases of human viruses. Yeah, for example, here, HRV, human rhinovirus, enteroviruses, and others. And we found these inhibitors are pretty broad spectrum rhinoviral and enteroviral protease inhibitors from human, bovine, and porcine origin. So compound 20, the most active here, inhibits in the range of 1 micromolar or below. And if you test proteases from human origin, like trypsin, chymotrypsin, factor 10A, or caspase, you see virtually no inhibition at all. So it's specific for this virus or these viral proteases. Also here, we were able to generate a crystal structure showing that the inhibitor in fact binds in the S1 pocket of the protein. Now that is our inhibitor in the S1 pocket. The green is the binding of larger inhibitors of these proteases from peptidic origin. And if you take a close-up here view of the active site, you find that the cysteine residue 147 here attacks this asterisk marked carbon in these inhibitors, which fixes this inhibitor in the active site of the protein. Good, so far for that. We extended our work on the 3C proteases, looking at other protein catalyzed templated reactions as well. And our next step here was to go from the amidation reactions or the irreversible inhibition that I showed before to CC coupling, carbon-carbon coupling reactions. Yeah, can a protein catalyze a carbon-carbon coupling reaction? And for this, we again looked at an enteroviral 3D protease of enterovirus D68. This is again a protease that recognizes the glutamine in the P1 site, here hydrogen bonded amide. And a simple fragment that has been found to bind here is this benzaldehyde carrying an aromatic amide. This is a weak inhibitor, 48 micromolar is the IC50. And the binding here is assumed to occur as shown here. So first the non-covalent binding here to the oxyanion hole with this oxygen that is activated by that and then attacked by the cysteine residue to form this reversibly this covalent adduct. Yeah, and you can also show that in the docking of these different states of inhibitor binding. So our idea was to use this protein-bound aldehyde for CC coupling reactions. And we looked at aldol reactions, aldol type reactions. And the hypothesis was, as shown here, that this aldehyde is activated by the hydrogen bonding here to enable a reaction with a carbon nucleophile, for example, with this enol structure. if that should be possible, yeah, we would find here an aldol condensation, an aldol addition product that is stabilized by the protein. And that might be then react further in aldol condensation to form this alpha-beta unsaturated carbonyl compound that might act here as an inhibitor for a Michael addition reaction with the cysteine 147. The dockings of these reactions indicated that this indeed might work. We find nice and yeah, understandable reactions of these intermediates with the protein, as shown here, for example, for the aldol addition product. Yeah, this fits nicely into the oxyanion binding pocket and retaining the interactions of this primary amide with the S1 pocket of the protein. So therefore, we did again a screen, and we screened this starting aldehyde with a selection of C-nucleophilic fragments, very small fragments, testing increased inhibition of the protease. And indeed, we found 5 hits here that showed increased inhibition. And the best one was F4, that is this simple cyanoacetone compound. Sorry? Is there a question or a remark? Okay, then I go on. So we looked at the kinetics of this protein catalyzed reaction. And indeed, we found that inhibitors were formed. So there is a Knövenagel reaction with this aldehyde forming this inhibitor 5. And this reaction is protein dependent. It's only happening if the protein is present. There is some background reaction, but there is a significant acceleration of this reaction in presence of the protein. Yeah, and it works also if you have an excess of the reagents, but it also works with very limited conditions where you have, for example, only very small amounts of aldehyde. You still get this here catalyzed to this inhibitor formation. So this was the first, to our knowledge, the first example of a protein catalyzed Knövenagel reaction to form inhibitors. And this was, of course, driven by the significant increase of inhibition of this reaction product. Yeah, we started with 48 micromolar IC50 for the starting aldehyde. The product had 550 nanomolar inhibition. So we tested a lot of different fragment combinations here. And the best ones were all in this range here of below 1 micromolar inhibition, IC50. However, when we went into the cellular assay, most of these inhibitors showed much less activity in the cellular assay, in the antiviral activity in infective cells. Others, like, for example, this malonic acid-derived inhibitor, performed much better. They also had a low micromolar inhibition of viral replication in the cellular assay. And we wanted to understand these differences. Yeah, why are some only good in the enzymatic assays and others are also good in the cellular assay? And to, yeah?
Can you hear? Yeah, I'm sorry, we are running out of time. If you can please wrap up the last minute of the time, please.
Ah, okay. Is it? I thought I had I had time until it's now 8:15, right?
Yes, we will be past 3 minutes right now. Yeah, I apologize for that. Yeah.
Yeah, I thought I had time until 8:30. Is that not correct?
No, it is actually we just run out of time. It's 12:15 here, your time. So if you can please conclude the conclusion remarks. I appreciate that. Thank you.
Okay. Yeah, because on my schedule, I have time until 8:30. So that is not correct. That has been changed.
Yeah, that's what it says here. It's we have 11:45 till 12:15.
Okay. Yeah, the schedule you sent to me said that I have time until 30.
Okay, I think I was provided that you can have 5 minutes of your last minute.
Okay. Because I mean, I got a schedule that said 11:45 until 12:30. So that was sent to me by the organizers. So
we gained
I mean,
5 minutes. Okay, no problem.
Okay. Yeah. Okay. I mean, sorry for running out of time, because I was informed by the invitation that I have 15 minutes more, but maybe that has been changed. All right. Let's shorten it a bit here. So what we have analyzed is the kinetics of this inhibition of the protease, looking at the reversibility of this different covalent inhibitors. And for that, we used biophysical methods like ITC, and were able to show that the slowly binding inhibitors are much better in the cellular inhibition assay than the fast reversible inhibitors. Yeah, so this inhibitor here shown up to the right is more slowly than that to the left. And there is a method that you can show this different kinetics, that is biolayer interference. Yeah, it's a method similar to surface plasmon resonance. You can directly from this binding curves calculate or measure the on and off rates of inhibitors, and that gives us then an explanation, yeah, how these inhibitors work here in this complex reaction system that's indicated here, combined of inhibitor formation through, first of all, aldol addition, then aldol condensation, and finally the attack of this aldol by a Michael addition reaction. And that explains that the slowly reversible inhibitors with the low K-off values are those that perform best in cells. So the last 10 minutes I scheduled for another topic that is shown here, STAT5 inhibitors. That is a transcription factor. And I will go very slow that because the time has been reduced here. We found here fragment hit, that is a low affinity fragment. We identified a new protein templated reaction, that is a Mannich ligation reaction, forming this type of inhibitors. We are able to show that this works in the assay. And this is a mechanism of this Mannich ligation reaction. We have a starting fragment, it reacts with formaldehyde first, and then it is able to add with a tetrazole anion, forming this inhibitor. We can show that this is happening only if the protein is present. It's not happening in solution without the protein. It's a protein catalyzed reaction. And we find inhibitors that go down below 1 micromolar, and we can show that this works nicely in cells, blocking the DNA interaction of STAT5 dimers. That's shown here. It's blocking the phosphorylation of STAT5, and that leads to the killing of STAT5 depending cancer cells. And I will skip the details that explain that in larger detail. The only thing I would like to say is that in the final animal experiment, we are able to show that the cancer is, the growing of the cancer is significantly blocked here with these inhibitors compared to the untreated animals that needed to be killed here because the tumor was getting too big. And this is working in synergy with a kinase inhibitor, which is shown here in this combination index experiment. All right, so short summary. I hope I have shown you that this protein templated reaction can form potent inhibitors, that the chemical scope is here extended, and that we get from this molecules that are useful for target validation and also for drug development. With that, I would like to thank you and my collaborators. These are the collaborators. This is our institute here, old picture, new picture, and thank you for your kind attention. I apologize for the timing here. Sorry, I was told to talk until 12:30 before. All right, I hope you have some questions. Thank you.
Thank you very much, Professor Ivan. Since we run out of time, I don't think I will take a question from the audience. I will ask myself a full question, if I may. The structure-based drug design and the ligand-based drug design, which one do you think will call it much more timely and effective in terms of cost, in terms of speed? The protein structure-based drug design or ligand-based drug design?
Yes, I can hear you. I mean, my experience is that, I mean, we use a lot of structure information here. However, especially in fragment-based drug discovery, structure-based drug design is very difficult because it is difficult to model the binding of such small fragments correctly. So predictions are possible, but do not have to be true. And therefore, we think it's very important to do also the ligand-based approach where you really experimentally go forward step by step. Yeah, it's not easy to have a good prediction of fragment binding. Therefore, here experiments are especially important, I think.
Thank you very much again, Professor Adnan. Let's thank to Professor Adnan one more time.
Yes. Yes, thank you for having me, and I hope that we can do that in the future in presence again without these complications. Okay, have a nice conference. Yeah.
Thank you.
Thank you.
Appreciate that. Okay. Without further ado, I would like to invite our last speaker of the session. It's going to be not online, hopefully. It will be Professor. I would like to invite Professor Masood Parvez. He's a distinguished professor, retired professor at the University of Calgary, Alberta, Canada. And he's also adjunct professor at here at ICCBS, University of Karachi. And his research interest is X-ray crystallography. Other achievements, he has more than 850 publications for international journals. And he's offering graduate courses, workshops, lectures, and X-ray crystallography training at universities in Pakistan by invitation. The title of his talk will be The Hydrogen Bonding in Natural Products. Professor Masood Parvez, welcome.
Thank you for your kind words. Assalamu alaikum. Let's get started. How many people know this brilliant scientist from Pakistan? Everyone? Are you sure? If you don't, then you should not be here, right? What he said yesterday on the inaugural lecture, do you remember what he said? I remind you, he was talking about epilepsy in neuroscience, right? And he said something very interesting. Learning is formation of hydrogen bonds. Remember it now? And then he said, forgetting is breaking of hydrogen bonds. I thought he's going to give a lecture on my topic. Then he talked like this. But I was lucky that he did not indulge into my area of interest. Hydrogen bonding in natural products. I will try not to bore you too much with complicated structures, and it'll be very simple talk. This has been already mentioned about it. Hordenine, a simple natural product found in the cacti grown wild in South America, in North America. Then the foreign people invaded North America. The Red Indians used to eat the mescal buttons from the cacti, and that would alleviate the fear of death. They would go at war with the invaders. That was their lifestyle. It's a very simple molecule. I studied this during my PhD level, when I was doing PhD sometime back. What is interesting is it has a very simple structure. I think, yeah. When you look at the molecule, it has a nitrogen, hydroxyl group, a hydrogen in between. The structure was done from the photographic data in 1974-75, and we were able to locate the hydrogen atom with the X-ray data from the photographic data. It was something unique at that time. This distance is 1.2 angstrom. This distance is 1.5 angstrom. Only a matter of 0.3 angstroms. If this hydrogen was shifted on the nitrogen, this would result in an azoto ion. Most of these catecholamines, adrenaline, noradrenaline, and many of the related compounds exist as azoto ions. The hydrogens shift from oxygen to nitrogen in those cases. Hydrogen bonding plays a unique role in natural product chemistry. The definition of hydrogen bond, what we call a hydrogen bond, a chemical bond is between the chemical bond and non-bonding interactions, like the van der Waals interactions. When I was looking at the previous talk, I was really amazed how important it is in the case of proteins and all those in the drug actions. Hydrogen bonds may be utilized for drug design. The last lecture covered a lot of it. Then organized molecules for biomimetic chemistry. Self-assembly of supramolecular species. You want to make big clusters of molecules, you need the help of hydrogen bonds. Spiral resolution of crystallization, modification of crystal morphology. Then design and preparation of ferro and pyroelectric crystals. These are some chemical applications of these hydrogen bonding, how we can develop these compounds in chemistry in general. Preparation of synthetic fibers with special properties. So a hydrogen bond is essentially electrostatic interaction, resulting in an attractive force between hydrogen atom covalently bonded to a donor atom B and an electronegative atom A. This was defined by Pauling some time back. The strength of the hydrogen bond depends on the relative electronegativity of donor and acceptor atoms. Some of the carboxylic acids and are widespread in natural products. They can often combine with amines, amides, and other nitrogen sulfur-containing functional groups. A lot of compounds which occur in the nature which have these entities. Functional groups in natural products are as donors or acceptors. Normally they are hydroxyl groups, amino groups, sulfur hydrogen, carbon hydrogen. Then the acceptors are all these are electronegative elements which are used as the acceptors. The principal criteria to recognize hydrogen bond in the solid state is the distance between donor to acceptor, hydrogen to acceptor distance, and the angle at the hydrogen atom itself. The distance is generally less than the van der Waals radii. From experimentally observed, these distances are type of hydrogen bonds. When hydrogen is attached to oxygen or nitrogen, the angles, the distances could be 1.4 to 2.1. So this is the range of distances which are observed between hydrogen and the acceptor atom. So these are normal accepted values for these hydrogen bonds. All hydrogen bonds may be characterized as belonging to one of the only 4 pattern types. We can have chains of hydrogen bonded materials. We call this a chain or C. We have rings, where the hydrogen bonded structures give us rings of several atoms. Then we can have dimers, where the 2 molecules link together through this hydrogen bond. Or we can have self-assembly of these intramolecular interactions, resulting in a self or S bond. The first 3 of these involve intermolecular bonds, and the last one intramolecular. The number of donors and number of acceptors in the size of patterns. For example, the G specifies the total number of atoms in the pattern G, A, and B, and with the number of members in it. For motifs which are generated from intermolecular hydrogen bonds, these designators are C for chain or catmer, R for rings, then D for dimer, and S denotes an intramolecular hydrogen bond. These are normally used when we define these hydrogen bonds in these natural product molecules. Examples of graph set representations. The benzoic acid dimer is a motif with graph set R228 and hydrogen bonded phenol triphenylphosphine oxide. Here has a graph set D. We can represent it. How many members are there? 1, 2, 3, 4, 5, 6, 7, 8. So there are 8 atoms which are linked in this hydrogen bonded system. So this would be R228. So in this case, when the phenol is bonded to triphenylphosphine, we call it D. It's a dimer between 2 molecules. So C4 will be a chain, a simple chain of molecules. And for S8, 8-member ring, 6-member ring, and we have R4, 2, 8. 1, 2, 3, 4 members, and there are 2 acceptors, 8-member ring in this case. In some of these other molecules, in nitroanilenes, the hydrogen bonded pattern R1 for between amino acids and 2 oxygens of a single nitro group. This should be over there, R12. Is a common feature of nearly all known nitroanilenes. So we have a very simple structure in this case. In molecules containing ROH groups with water and alcohols, the structure of ordinary hexagonal form of ice, its building block being the simple molecule in the series, is given by a simple molecule, water molecule, the most abundant natural product on this earth. So what is special about this? It has a very special structure. All the oxygens and hydrogens, they're interlinked, they're bonded through these hydrogen bonds. So it gives us these clusters. The molecules are arranged in layers of hexagonal rings or in tetrahedral forms. The number of papers have been published on ice crystals. And several of these, a few images of jewelry inspired by structures of ice. So symmetrical and beautiful molecules, I mean, these patterns. So jewelry is based on these patterns. If you recall the previous slide, the type of hydrogen bonds and the range of distances we mentioned earlier, these we may call these as classical hydrogen bonds or conventional hydrogen bonds. There are bonds of this type in CO distance of 3.2, in CHO short enough to be taken as a hydrogen bond. This was questioned by Sutter in 1963. Such bonds were challenged as hydrogen oxygen of 2.4 is no evidence of hydrogen bond information, Donahoe in 1968. These are controversial at that time, but things have changed. This twin hydron alternated ribbons of then mesoquinone and hydroquinone molecules held together by CHO and CHO interactions. So these are ribbon of molecules which are held together by, these are not conventional hydrogen bonds. They're not classical hydrogen bonds. We may call these a non-classical or non-conventional hydrogen bonds. So what is special about these? In this molecule, you will see in uracil, one carbonyl oxygen has two NHO bonds and the other two CHO contacts. Stewart and Jensen in 1969 discovered that these are conventional and non-conventional bonds in both of these molecules, in this molecule. Is a double bond donor hydrogen bonded system less favorable? Crystal structures tend to involve the maximum number of acceptors in hydrogen bonded stream. Etter, published in 1982. There are these kind of sp bonded hydrogen to OH interactions. These are very well known. And Ferguson and Islam in 1966 published this result. He was from Bangladesh, and Ferguson was my mentor in Canada when I moved to Canada in 1977. Then there are sp2 type hydrogen bonded with oxygen. These interactions result in dimers, and you can see these clusters having different kinds of hydrogen bonded patterns. More contacts across two-folded screw axis from a later structure published by Trotter in 1960. From tertiary hydrogen, sp3 hydrogen, or interactions. In acetic acid, for example, in finite chains of molecules linked with CHO energy of 1.2 kilocalorie per molecule stabilizes the dimer. So we have a very simple structure in this case. The hydrogen bonding arrangement of molecules containing acids have always been, when interesting to look at. These are some of the molecules. With these, you can see the orientation of these hydrogens, S, and this is A. So when they are in touch with each other, they are in contact with each other, they result in two equivalent orientation, A and D are there. So they form these bonds. Such systematic molecules often exhibit equal CO bond lengths and disordered hydroxyl hydrogen atoms. Most of these cyclic dimers make lateral contacts with each other, forming a chain or a layer. I think I'll stop here. Thank you all for this. Give me a chance to talk to you. I will not interfere with your appetite. The lunch time is there, and I think I'll stop it here. Thank you.
Is there any question from the audience?
Any
We
questions?
have time. Since we extended time, so we can take one or two questions. There is any. There is one in
Yes.
the middle.
Sorry.
Very nice talk. My name is Seghamullah Shardi. I'm a student. I have a question. Hydrogen bond has many importance. Okay. Why we not use the water as a medicine or treatment of any disease?
Water itself has a very vital role. It can be used as a medium for providing access to many of these, medications to our body. But itself, for its role, it can be injurious to your body if you take too much water. I have seen competition for drinking water in America, and people have killed themselves. They drank too much water in competition and eventually died. It was in the news. So water can be fatal. It can be helpful, but has to be used in moderation. So itself as a medicine, I'm not aware of any of these. What are the natural products for that?
Okay. Thank you, sir.
Any more questions? I take one more last question. There is any? If not, let's take the Dr. Ferris again from last time.
Thank you.
I have one last announcement before we move to lunch. The sightseeing has been arranged for foreign delegates. The vehicle will depart around 6:30 sharp today evening. And from the guest house, please kindly gather around 6:30 in front of the guest house for the sightseeing. And after the lunch, there will be parallel sessions, as you know, it happened the other days. So AG and halls, ABC, as well as the auditorium. So the volunteers will guide us all the different sessions. And with that, I would like to close this session. Please enjoy your lunch, and thank you very much.